Sleep apnea is a sleep disorder characterized by pauses in breathing or shallow breathing during sleep. It can have a significant impact on lung health and overall well-being. Here are some important points connecting sleep apnea and lung health. Obstructive sleep apnea, OSA. The most common type of sleep apnea is OSA, which occurs when the throat muscles relax and obstruct the airway during sleep. This obstruction leads to breathing pauses, often followed by loud snoring or gasping for air. These recurrent pauses can lower the oxygen levels in the blood and strain the lungs. Effect on lung function. Sleep apnea can affect lung function by causing a decrease in oxygen levels and an increase in carbon dioxide levels during sleep. This can lead to chronic low oxygen levels in the blood, hypoxemia, and elevated carbon dioxide levels, hypercapnia, which can strain the respiratory system and impact lung health over time. Sleep fragmentation. People with sleep apnea often experience frequent awakenings throughout the night due to the breathing pauses and gasping episodes. This sleep fragmentation can lead to daytime sleepiness, fatigue, and impaired cognitive function. It may also contribute to the development of respiratory disorders and worsen existing lung conditions. Increased risk of respiratory conditions. Sleep apnea has been linked to an increased risk of developing respiratory conditions, such as chronic bronchitis, asthma, and pneumonia. The intermittent hypoxemia and inflammation associated with sleep apnea can worsen existing respiratory conditions and make individuals more susceptible to respiratory infections. Pulmonary hypertension. Sleep apnea can contribute to the development of pulmonary hypertension, a condition characterized by high blood pressure in the arteries of the lungs. The intermittent hypoxemia and increased pressure on the pulmonary arteries during sleep can strain the heart and lungs, leading to the development of pulmonary hypertension. Impact on COPD. Sleep apnea and chronic obstructive pulmonary disease, COPD, often coexist. The combination of these conditions can lead to more severe symptoms, increased risk of exacerbations, and worse overall health outcomes. Effective management of both conditions is essential for optimal lung health in individuals with coexisting sleep apnea and COPD. Treatment options. Continuous positive airway pressure, CPAP, therapy is a common treatment for sleep apnea. It involves wearing a mask that delivers a constant flow of air to keep the airway open during sleep. CPAP therapy can improve oxygen levels, reduce daytime sleepiness, and alleviate strain on the lungs. Other treatment options, such as oral appliances, positional therapy, or surgery, may be recommended based on individual circumstances. Importance of diagnosis and treatment. It is crucial to recognize the signs and symptoms of sleep apnea and seek medical evaluation. If left untreated, sleep apnea can have detrimental effects on lung health and overall quality of life. Diagnosis is typically made through a sleep study conducted in a sleep lab or using home sleep testing devices. Healthy lifestyle habits. Adopting healthy lifestyle habits can support lung health and manage sleep apnea. These habits include maintaining a healthy weight, engaging in regular physical activity, avoiding smoking and excessive alcohol consumption, and practicing good sleep hygiene. Increased risk of cardiovascular disease. Sleep apnea is associated with an increased risk of cardiovascular conditions, including hypertension, heart disease, and stroke. The intermittent drops in oxygen levels and the strain on the cardiovascular system during sleep can contribute to the development and progression of these conditions. Systemic inflammation. Sleep apnea can trigger systemic inflammation in the body, which can have negative effects on lung health. Chronic inflammation can damage lung tissue and impair lung function over time, potentially leading to respiratory conditions or exacerbating existing lung diseases. Impaired immune function. Sleep apnea can weaken the immune system, making individuals more susceptible to respiratory infections. The repeated episodes of low oxygen levels and fragmented sleep can compromise the body's ability to fight off pathogens, increasing the likelihood of respiratory illnesses. Daytime fatigue and impaired performance. Sleep apnea can cause excessive daytime sleepiness and fatigue, which can impact daily activities and performance. Feeling excessively tired during the day can affect cognitive function, productivity, and overall quality of life. It is important to address sleep apnea to improve daytime energy levels and maintain optimal lung health. Impact on sleep quality. Sleep apnea disrupts the normal sleep cycle and can prevent individuals from entering restorative deep sleep stages. Poor sleep quality can affect various aspects of health, including immune function, cognitive performance, and mental well-being. Adequate and restful sleep is essential for overall lung health and functioning. Relationship with obesity. There is a strong association between sleep apnea and obesity. Excess weight can contribute to the development or worsening of sleep apnea by increasing the amount of soft tissue in the throat that can obstruct the airway. Addressing obesity through weight management strategies can help improve sleep apnea symptoms and promote better lung health. Impact on oxygen saturation. Sleep apnea episodes can cause significant drops in blood oxygen saturation levels. These drops can result in tissue oxygen deprivation, including the lungs. Chronic low oxygen levels during sleep can have long-term consequences on lung function and overall respiratory health. Collaborative approach to treatment. Managing sleep apnea and maintaining lung health often requires a multidisciplinary approach involving healthcare professionals from various specialties. This may include sleep specialists, pulmonologists, cardiologists, and dentists, among others. Collaborative efforts ensure comprehensive evaluation, accurate diagnosis, and tailored treatment plans for individuals with sleep apnea. Regular follow-up and monitoring. Once diagnosed with sleep apnea, regular follow-up and monitoring are essential to ensure treatment effectiveness and adjust interventions if needed. Regular assessments can include evaluating symptoms, monitoring treatment adherence, and assessing lung function through appropriate tests to ensure optimal respiratory health. Increased risk of respiratory failure. Severe untreated sleep apnea can lead to respiratory failure, where the lungs are unable to provide sufficient oxygen to the body. This can be a life-threatening condition requiring immediate medical intervention. Impact on asthma control. Sleep apnea can worsen asthma symptoms and control. The interrupted sleep patterns and decreased oxygen levels during sleep can trigger asthma exacerbations and make it more challenging to manage asthma effectively. Impaired gas exchange. Sleep apnea disrupts the normal exchange of gases in the lungs, leading to inefficient oxygen and carbon dioxide exchange. This can strain the respiratory system and compromise lung function over time. Increased risk of pulmonary embolism. Sleep apnea has been associated with a higher risk of developing pulmonary embolism, a condition where a blood clot travels to the lungs. The disrupted blood flow and decreased oxygenation during sleep apnea can contribute to the formation of blood clots. Impact on quality of life. Sleep apnea can significantly impact quality of life, including overall physical and mental well-being. The sleep disturbances, daytime fatigue, and impaired cognitive function can affect daily activities, productivity, and emotional health, ultimately impacting lung health indirectly. These points highlight the complex interplay between sleep apnea and lung health, emphasizing the importance of early diagnosis and appropriate management to promote optimal respiratory function and overall well-being.